Good morning, everyone. Good afternoon, wherever you are. My name is Martin Reimann. I'm a professor in the College of Veterinary Medicine and in the Eller College of Management. It's my pleasure to facilitate the Human-Animal Interaction Speaker Series at the College of Veterinary Medicine, and my pleasure to announce Maggie O'Hare, who is a professor at the same college and also our Associate Dean for Research. Maggie is an internationally recognized Fulbright Scholar. She earned her BA in psychology from Vassar College in New York and a PhD in psychology from Queensland University in Australia. Her research deals with the way humans interact with animals, particularly with service animals, and that will be part of the talk today. And Maggie is well published in many of our leading journals, has received funding from the major government institutions, has received a lot of media attention, including NPR, the Wall Street Journal, and New York Times. Maggie, it's a real pleasure to have you here today, and we all look forward to listening about your research. Thank you so much.
Wonderful. Thank you so much, Dr. Reimann. It is an honor and a pleasure to be here today to give this seminar on human-animal interaction. So today I'm going to be talking to you about the science behind the human-animal bond and specifically giving you insights from our service dog research. So this research really stems from the idea that humans are drawn to animals. So if we think evolutionarily, we would have grown up around animals and nature, but today we spend time in this hectic and technology-driven society where we spend less time around animals and less time around nature. And the question emerges, what impact does this have on our mental health and wellness? And so even though we don't have the same exposure to animals as we may have historically on a constant basis, we still try and seek out that contact wherever we can. So one of my favorite examples of this is the zoo. So each year, millions of people travel and pay money just to stand there staring at animals behind glass. And in the US and Canada, the number of people who do this is more than the number of people who attend all major professional sporting events combined. So it's a really pervasive cultural phenomenon, the fact that people want to seek out and have some form of contact with animals. And we know that this is pervasive because even in the sports world, it has become very popular to the point where on Super Bowl day, I'm not sure if you've heard of the Puppy Bowl, but when that airs, it's the most watched cable television show on that day. And that means that now people will just sit at home and watch animals on a screen and be overjoyed with it. And so bear with me, but if you'll believe it, people actually also share their homes with these creatures. So I'm not sure if those of you on this call are a pet owner or not, but in the United States, about 70% of households or over 90 million homes house a companion animal. And that's up from 56% in 1988. So it's this growing and pervasive cultural phenomenon. And we know that it's not cheap. It's a very large industry. So imagine your pet if you have one, and I'll tell you about mine, but she doesn't pay rent. She's a dog. She doesn't cook me dinner. She doesn't do anything that appears to be of utilitarian value. And yet I am delighted to pay for her toys, for her to go to doggy daycare, I love bringing her to the vet. So the question becomes then, is my animal, is your animal, our companion animals parasites? Or is there something else to this relationship that creates something bidirectional that can be beneficial in both angles? And so the question that really emerges from that is, are there health benefits? Because we know that an animal isn't going to provide the money, but are there other ways that they're contributing? And so one of the first studies to look at this is called the heart disease study. And what they did is they had a group of people who survived a heart attack, and they were released from the coronary care unit, and they were followed for 1 year. And 1 year later, they found that those people who had a pet were more likely to be alive than those who did not have a pet. They actually had 1/3 the mortality rate. And that was after controlling for socioeconomic factors, severity of the disease. It was presence or absence of an animal that led to the difference here between life and death. And this was published in a major medical journal. And it was the first time that people started to take this a little bit more seriously, to think that it might be more than something cute and fuzzy that is quirky and shares our home, and something that actually is leading to direct measurable health outcomes. So this is the type of study that guides my research and that guides, the type of rigorous science that we hope to be conducting here in the College of Veterinary Medicine related to human-animal interaction. And we've seen that the roles for dogs in our lives are expanding. So historically, we might have just thought of pet ownership. Now we're seeing dogs in many different roles, whether it's a service dog or a facility dog or a therapy dog. These are growing. So the area that I'm going to focus on today specifically is a service dog. And so that is a dog that's trained to do a specific task to help mitigate something with a disability. So if we look at these active assistance dogs teams, and through Assistance Dogs International, these are the proportions that are in each category. So the most common are guide dogs, followed by mobility and service dogs. But then we see that the third most common type of assistance dog worldwide is a psychiatric service dog. This is fascinating to me because if we look back about a decade ago, roughly, this category didn't exist. So I think we're certainly expanding in the areas that animals are assisting in human life. And this one, I think, is one that's certainly on the rise and worthy of study. So why is research important on this topic? For those of you who joined the call and may have an interest in this already, many people who have a pet or like animals say to me, well, I already know my dog helps me. Like, why should we study it? Why should we care? This is framed around service dog research specifically, but service dogs are in high demand. The wait list for a service dog pre-COVID was on average 2 years, from the day someone says, I desperately need this dog, to the day they get it. During COVID, they started scheduling out 5 years from the date that they applied for the dog. So the demand is exceeding capacity. And part of that is because existing funding for these dogs is limited. And one of the reasons for that is because there isn't science to document the efficacy. If you look at things that, an insurance company would cover or, the government is going to pay for, they're looking for evidence. Despite warm, heartwarming stories, it's truly the evidence that, the numbers that they need for this funding. Also, clinicians need evidence. I can't tell you how many times a clinical psychologist or a doctor or a GP has come to me and said, someone came into my office and said they need a letter for a service dog or they need a service dog, and I don't know what to tell them. The reason they don't know what to tell them is because if someone comes in with difficulty seeing or a heart problem, they look to the evidence, they know what scan to do, they know then what treatment to administer. That evidence base doesn't exist for service dogs. So when presented with that need or that issue, their options include turning the person away, providing evidence that might not actually be, or advice that might not actually be helpful. But at the end of the day, they're not feeling confident in how to manage those situations. And that can put people at risk of not getting the services or the advice they need. Next, teams need public support. So by teams, I mean the person and their service dog. Public access laws are determined based on science. Policies are ever changing, and we're being requested to give briefings on what evidence is there so that they can determine what policies to put in place. And without those policies, people don't have the support to bring their service dog where they need to go. And I find this to be specifically important for disabilities that are not typically visible, such as psychiatric disabilities, because it's truly, community education and policy that's needed to support them. And then finally, effectiveness can be maximized. So if you think about drug treatment or trials, let's imagine Tylenol, they're not providing the same pill that they provided when it was first developed. The reason is you want to increase the efficacy and reduce the side effects. I think we can do the same thing for service dogs and animal interventions to find ways to help the dogs do their best, to be thriving, for the person to have better outcomes and for the dog to have better outcomes together. So I think it's not just a stale point that we have now. I think there's room to grow. So as you can see, I'm quite passionate about this. I could probably have 20 slides on it and continue to burn your ear off with why I think the research is important. But these are just a few of the high level reasons why I don't think it's appropriate to just, settle and think, well, we already know that we like animals. There's true reasons why we need this science. So I am very fortunate that here at the College of Veterinary Medicine at the University of Arizona, this is one of our premier areas that we are focusing on. So we have the ability to conduct some strong science in this domain with support and leadership and expertise throughout our college. So I'm going to talk to you about 3 areas today that we're currently studying in our CVM. The first is service dogs for military veterans with PTSD. That's where I'll spend most of the time. Then I'll touch on facility dogs in hospitals, specifically pediatric oncology hospitals. And finally, service dogs for children with autism and their families, which is one of our emerging areas. So you may have seen in the news or the media some wonderful stories about service animals and PTSD. I know that it's prevalent in the media, and what I can tell you is that what you see in the media far outpaces the research and science that we have on this topic. But because of that, there's a strong demand and interest in these dogs. I think we have a duty to conduct science to determine if these dogs are able to meet, I don't want to call it the hype, but able to meet the vision that is portrayed in the media. And so why would we study this area? We know that PTSD, or post-traumatic stress disorder, affects many military veterans. So if you look at the numbers, they say that up to 1 in 5 from these conflicts have PTSD. That's likely an underestimate, because that's those that meet formal diagnostic criteria and actually go to get that diagnosis. And then it's really difficult to treat. So one of the most prevalent reasons it's difficult to treat is that people don't go to seek treatment. Very hard to treat if you don't seek treatment. So only 50% of those with a diagnosis will actually seek treatment. There's many thoughts around why this might be, whether it's stigma or that it's not palatable, these treatments. Then of those that do seek treatment, about half will drop out. The reason for that is the primary first line of evidence-based treatment is exposure therapy. And that means that you need to be exposed in different amounts to the stressor so that you become comfortable with it. But if you know that on Wednesday at 9 a.m., you're going to show up to an appointment where you have to think about and be exposed to the most traumatic thing that happened to you, sometimes people don't show up to that appointment. And so there's large dropout rates. And then even of those who finish a full course of our frontline evidence-based treatment, 60% will still maintain a diagnosis of PTSD. So it's very challenging to treat. And because of that, veterans are seeking out complementary interventions. And I really want to highlight the word complementary. That means in addition to evidence-based care. There is no recommendation anywhere to replace evidence-based care with a service dog, but because of the challenges that exist, the idea is to add that into the mix because these individuals need access to a variety of resources to meet their needs. So service dogs are increasingly popular as one of these intervention options, and we'll talk a little bit about what does that look like and what do they actually do. So on the left here, I'll put the symptom of PTSD, and on the right, what the dog does to help. So one of the key symptoms is flashbacks or nightmares. The dog can help interrupt distress when that happens by putting their paw on them or nudging them to help bring them back to the present and be mindful. Next symptom is hypervigilance or constantly feeling on edge. The service dog can help monitor the environment and the individual. So in the picture here, for example, if the person is at the ATM to get money, they might feel very scared or stressed that someone could come up behind them. The dog simply faces the other way. If someone's approaching, nudges them, and that simple act can make them feel at ease to go about their day and complete the tasks they need to. And finally, there's negative thoughts and moods, depression, anxiety, and the dog can help be a source of companionship and joy. So I'm going to show a little video here of what this looks like, just to kind of give you a taste of what a dog might do just in an everyday interaction.
Nightmares are relentless. The anxiety is sometimes overwhelming. Flashbacks can be brutal. But together, we give them help.
All right. So what I like about that video is that okay, I hear that the audio was not super clear, but you could see the visuals. That's fine. In past presentations, I've had to sort of act this out even when the video didn't work. So I'm glad you at least got the visuals. That is helpful. But what I like about this video is that it's showing that in the reality of the situation, there is not a danger. There's not a threat. However, for the individual with PTSD, in their mind, certain things trigger flashbacks, anxiety, and feeling like they are in trauma again, whether it's the loud noise of a leaf blower or simply something in their mind that emerges. The dog is then able to bring them back to the present. The dog knows that there's no real danger and is able to simply lick their hand or nudge them or bring them back to that present feeling of safety and comfort. And it's these tiny things that happen throughout that video that enable that individual to actually leave their house, go about their daily life, and engage in society. Hopefully that covers what you may or may not have been able to hear clearly. And thank you for that note. Feel free to pop things in the chat like that. Our United States Department of Veteran Affairs has actually come out with a statement that clinically there's not enough research yet to know if these dogs actually help to treat PTSD, so that we can't draw conclusions on the studies that have been done to date. So it's statements like this that motivate us to create that rigorous evidence base, and that is our goal. We have made some strides since this in terms of legislation and access, but there's a long road ahead, and it's truly large-scale clinical trial evidence that's needed to change this. So how are we working to fill that gap? We have currently partnered with Canines for Warriors, which is the largest provider of service dogs for veterans with PTSD. And our goal is to quantify the efficacy and role of service dogs. So efficacy, do they work? And role, how do they work for veterans with PTSD? We also have other partnerships with providers doing incredible work as well. So how do we actually measure this impact? The first way that we do this is through clinical surveys. So if you were to need medication for anxiety or depression and you visited your clinician or you were part of a clinical trial, we're using the same surveys that would be used to determine efficacy of those treatments to see if a dog makes a difference. We also use biological samples to see if there are changes in stress hormone physiology or the way that your body reacts to stress in its environment when you have the dog. And finally, we use a smartphone and dog collar combination that I'll tell you a little bit about. So in terms of our clinical surveys, we conducted a cross-sectional nationwide trial comparing individuals with a service dog to those without. And we found that veterans with a service dog had lower PTSD symptomology. The difference that you see here is that they have a clinically meaningful difference in PTSD symptoms if they have the dog. I also want to note here that they are not without PTSD. They still have PTSD, but it's clinically lower. The next thing that we found is that those with a service dog reported better mental health. So what that looks like is we're seeing, I'm sorry, I'm trying to move this around so I can see it, less depression, less anger, and less anxiety. And these are measured through the National Institutes of Health initiative to do patient-reported outcome measurement information systems. So these are standardized measures used across clinical trials for humans in a variety of domains. And we see again here that the service dog makes a meaningful and significant difference. And finally, we saw that veterans with service dogs had less absenteeism from work due to health if they had a service dog. I think findings like this are critically important when we think about community engagement, society, potentially the economic impact. If an employer is making decisions on whether a dog can come to work or not, if they know that individual is more likely to show up to work, if you provide them the accommodation of enabling a dog to join them, that is a compelling piece of data that's worth knowing. So that's just a simple taste of our clinical surveys. We have many more along those lines. My goal today is just to give you a high level on the types of things that we're measuring so far. The next area to look at is our biological samples. So the one that we will look at today is when thinking about the neurobiology of stress and the stress response system. One that we're able to non-invasively capture is cortisol. So we want to look at that stress response system. How do we capture that when we are doing a nationwide clinical trial and we never actually meet a veteran in person? How do we do that? We send them saliva samples that they collect, and we want to capture that in the morning because that's where we see a cortisol awakening response. So this dotted gray line here is a healthy adult cortisol pattern. It should rise when you wake about 30 minutes and then go down through the day. It's a diurnal pattern. For individuals with PTSD, we see this green line. It's a blunted arousal. There is so much hyperactivation during their everyday that their body stops responding in the same way that a healthy adult will respond to even something such as waking up in the morning. So we look at this rise, and you can see here a sample of our veteran collecting it. He's so happy. look at how much fun it is to collect spit for science. When we first started sending out these saliva kits before COVID, people were very curious why scientists would call them on the phone and ask for their spit. I think people are getting a little more comfortable with that now, but I was really grateful and heartened by our veterans who were open to such a strange ask as this one. So you can see here, in the morning, he wakes up, he collects his spit into this tube here, he pops it in the freezer, and then at the end, we send them overnight and keep them frozen until assay. You can also see that he's wearing a couple of different wristbands to collect data for us. So I'm not touching on that today, but I just want to give a very big shout out and words of gratitude for our research participants for allowing us to ask so many odd things of them. So what we found with respect to cortisol, so we're looking at that awakening response, that rise. Individuals with a service dog have a larger cortisol awakening response than those who do not have a dog. And this is closer to the healthy adult stress response pattern of waking up in the morning. And that's one of the key metrics of cortisol, is this cortisol awakening response. So that was pretty interesting to see that on a neurobiological level, we can measure differences, presence or absence of the dog. We're following on to that with more samples. In addition, we're going to do alpha amylase via saliva and some other areas as well. And the final place that I will tell you about today is that we have a smartphone app and dog collar combination that we use in our studies. So we are collecting real-time data via the smartphone app. This is what it looks like. It will ping people randomly throughout their day to ask where they are, how they're feeling, what their dog just did. The reason this is so helpful is because most psychological research will provide you a survey and say something like, over the past month, how often have you done X? As humans are amazing, but we're not always incredible at remembering at that level of detail. So for example, if I asked you on Wednesday, 3 weeks ago at 2:33 p.m., what were you wearing? Who were you with? How are you feeling? And what had you last eaten? It's very hard to remember that, but in the moment, we can capture that level of granularity to know how they're truly feeling and what their dog's doing. And then we can relate that back to some of their physiology, as you can see, again, wearing devices to track that. On the dog end, we have them wear a specialized collar. This is the whistle device. And what this does, this is a commercially available device, so you may have heard of it, maybe you've used it, but it tracks actigraphy, so through an accelerometry. So through that, we can get a metric of sleep and activity levels. And that is akin to what the human is wearing in the wristband here. The dog has it on their collar, so that not only can we understand the dog's sleep and awake patterns, but how that relates to the human. So one of our projects right now is to look at co-regulation between human canine dyads to see if they're aligned and whether that alignment leads to stronger outcomes. So I want to give a shout out to a CVM PhD student, Sarah Layton, who worked on this data, and what an amazing picture to have with 4 service dogs by her side. We all should strive for that level of bio picture. And what she has identified through that smartphone data is that veterans of the service dog had better daily emotional well-being. So they would report less panic attacks in the moment if they had a service dog. They also had less negative emotions measured via standardized validated scales and greater instances of positive emotion. So we're seeing a difference in their emotional profile throughout the day, moment to moment. Interestingly, we saw no difference in the number of social interactions. And to me, it's extremely important that we collect and present not only our significant findings, but also our null findings. I think that it helps us to understand differential validity and where there are differences and where there are not. And this surprised us. We thought there would have been more interactions. So although when we said, have you had an interaction in the last 4 hours socially, there was no difference. If they had an interaction, they found the quality to be more pleasant. And so that may be due to the fact that there might be a ceiling effect on the number of interactions you have in a day based on your lifestyle. However, if you have a dog present with you, that interaction may become more pleasant due to the social facilitation that it offers. We also found that veterans and their service dogs spend about 82% of their time together. So we did that via the dog's special collar. It sends a Bluetooth ping to the veteran's smartphone to see how often they are in proximity. And so there was variability, about 50 to 100%, but essentially the average being 82% of the time spent together is around 20 hours per day. And this one really strikes me as a key reason to study in the field of human-animal interaction, because if I asked you, is there anyone in your life that you would willingly spend 20 hours a day with? I mean, good for you if you have one or even a full list that you would like to put in that category. And that strikes me as very unique about this relationship, the fact that people are willingly spending this much time together with their dog. And if nothing else, to me, that is a relationship that warrants study and attention. When we look at trained tasks, so remember, we're talking about service dogs. That means they have to be trained to do a task to help mitigate a disability. So they're using each task about 3 times per day on average, according to the smartphone surveys. So I'm going to tell you about 5 different tasks we studied, and then I'd love to ask your opinion on which you think is the most commonly used. So the first is the dogs help interrupt or alert to anxiety. I think we saw a little bit of that in the video. The next is they calm or comfort from anxiety. These might look the same. The difference is in the first one, the dog initiates it, and the second one, the human initiates it. Cover or watch their back, block or create space so they can just feel safe in public, and then make a friend. That's a nice one because when a dog is wearing a vest, they're working, people shouldn't engage. However, you can ask and then the person can tell the dog, okay, make a friend. So you can go ahead and pop it in the chat or unmute if you'd like. Which do you think is the most commonly used task by veterans with service dogs for PTSD? Okay, I'm feeling like you guys already read the manuscript because you are getting the answer very much correct. So the answer is comfort, and that was by and large much more common than the other. So when we asked what task have you used in the past 4 hours, over half of the time they had used this comfort from anxiety task. The other ones were also used, on average 3 times per day, however, much less frequently. And to me, this helps address maybe the mechanism of how and why these dogs might be working, and that it's really targeting the anxiety piece of the PTSD puzzle. So that concludes my high-level primer on service dogs for PTSD and our research there. Our next steps are we currently are about to launch an NIH-funded national randomized clinical trial of service dog efficacy for PTSD. We are working with multiple providers at multiple sites throughout the United States, and it's going to be a 4-year study that we're really looking forward to launching to scale up and get more detail and rigor to the measures we've started. The next piece that I'll talk to you about today are facility dogs in hospitals. So for this project, we worked with a national provider called Canine Assistance, and this is one of their dogs here in a hospital that they work in. It's predominantly pediatric oncology units. And when you first look at this picture, most people assume that we're probably studying this girl here. And there have been some studies done on the patient population. That's obviously the primary goal. But what has been overlooked in the literature is actually the hospital personnel themselves, who are there day in and day out, facing a lot of trauma and helping families through very difficult processes. So we were curious to find out, are there any impacts for the personnel at the hospital? So we know that hospital personnel risk burnout. We see that on their mental health, depression, anxiety. We also have seen impacts on patient care. When an individual is facing burnout, that can lead to different impacts on medical mistakes or patient care. And finally, that can result in staff turnover. And that's one of the ones hospitals are very interested in that if their staff are so burnt out, they will quit and they will not have staff. So the question became, what impacts could a facility dog have there? Now, facility dogs are full-time dogs that are at the hospital. So it's not the visiting therapy dogs that come in with volunteers. A facility dog works with someone who is full-time working at the hospital, and they go to work with that person. So we worked with 38 different children's hospitals nationwide across 27 different states. So we had a nice broad sample. These are just a few of the hospitals pictured that we worked with to determine the impact of these facility dogs. And high-level brief findings, we found that those hospital personnel that had a facility dog had greater feelings of accomplishment at work than those who don't. And we matched the control group to the facility dog group based on their job role, time in the position, age, pet ownership, and a variety of different factors. And they simply worked on the same type of floor, but a floor that didn't have a dog. And the next finding is that those who had a facility dog had lower job turnover intention. So that's less likely to quit. And I think this was particularly of interest to the hospitals because, again, these facilities, unlike probably maybe more than many other places, the hospital has to make decisions based on science and data. There is just too much health and safety risk and other types of risk to not do that. And so they need this type of data to determine if facility dog programs are worth the investment and are safe, and to know that that could impact their bottom line with turnover has been very powerful for them. So I just wanted to give you a taste of our research in that domain. It's one that we're certainly excited to continue. And we also have other streams of data on that population, including the ecological momentary assessment. That's those daily smartphone surveys. We have whistle data on the dogs, kind of the same types of data streams we had for PTSD applied to that population that we're currently working through analyzing. And then the final piece that I will tell you about today is service dogs for children with autism and their families. This one is really hot off the press. We're just analyzing the data, so I can't even tell you that much about it, but I wanted to kind of highlight that as an area that we're focusing on in the college. So we ran the Canines for Autism research study with Canine Companions, which is the largest provider of service dogs for many purposes nationally. And our initial findings are showing that there are differences in sleep for the children. So parents are reporting that in the families where there is a service dog, the child can go to their room, independently stay in their own bed and sleep through the night, compared to families who don't have that dog. Now, I don't know about you. I don't know if you have a child or a toddler at home, or maybe you don't care about sleep and you're one of those superhumans I hear about that's like, I only need 3 to 4 hours and I'm good. Outside of you superhumans, we know that sleep is related to many life impacts, especially for children and families. It relates to school outcomes. It relates to parent outcomes. So we're really excited to think about sleep as a potential mechanism for how service dogs are impacting families of children with autism spectrum disorder. So those are 3 areas that we are exploring for human-animal relationship here in the College of Veterinary Medicine. We're really excited to grow these programs and expand our national reach and leverage connections across the university to really take these to the next level of impact. I want to acknowledge and thank so much the amazing O'Hare Lab graduate students and postdocs, some of them named here, the current ones in the lab, but obviously nothing I presented today was conducted in isolation. We have an amazing team here, and I'm so proud of all that our students are able to do and the opportunities we get to share with them. So huge gratitude for the workforce behind everything you see.